New COVID-19 cases, they are declining or stable from coast to coast, prompting several states now to announce plans to lift mask mandates in schools. Yet many people are still divided on this issue as the Omicron surge continues to take more than 2,400 lives a day. Let's talk more about this now and the easing COVID restrictions. President and CEO of University Hospital in New Jersey, Dr. Shereef Elnahal, joining us now. Doctor, great to have you. You know, across the U.S., hospitalizations have gone down nearly 50%. We've reported that just in the last week. And then there in New Jersey specifically, the daily positivity rate has dropped nearly 5% in the last 7 days. So are you and staff feeling some relief here?
We are, and thank you so much for having me. The trends you described are exactly what we're seeing here in New Jersey and in Newark. We're seeing a precipitous decline in cases and hospitalizations, and we'll likely see, according to most epidemiologists, a reprieve of up to at least a couple of months from coronavirus cases because of the immunity largely conferred by the rapid spread of the Omicron variant. And so I do think offering that reprieve to folks, to parents of school children here in New Jersey, is especially helpful in case we do have another surge. It's always great to have a break so that folks understand that we respond to surges with indoor masking, including local surges as well, and school districts locally will have that option here as well. So I do think it's a responsible policy move on the part of the governor.
So there has been still, though, some division and some controversy if that really is the right idea when you look at the number of kids that are still not vaccinated, getting sick, and then, you know, we know that wearing a mask does stop transmission in many cases. So as we look at all these various governors, including there in New Jersey, I mean, we're talking about Oregon, Delaware, Connecticut as well now, you know, how do you know that this really is the right idea moving forward? Because there really is kind of it's a hard thing to balance here. You want people to be able to make these choices, but at the same time, we know what protects our kids.
Yeah, these really aren't easy questions. And I know the public has a lot of them regarding indoor masking, especially for kids. Do remember that the idea of mandating masking is all dependent on the overall baseline risk that you or I or anybody faces in the community. And as long as spread is in the low category or moderate category, according to the CDC, adults really aren't even recommended to wear masks indoors. And so New Jersey, we're already there, and in so much of the country is approaching there. And so again, I don't think it's unreasonable based on overall risk to mandate masks, or at least remove that mandate. Now, for kids who are immunocompromised, for kids who are baseline dealing with chronic conditions, parents may still choose to have their kids wear masks. And on top of that, there's going to be a lot of anti-bullying and anti-discrimination efforts happening in New Jersey schools to make sure that kids who are wearing masks are not targeted. And so I do think it's the right balance for now. But of course, we have to be vigilant, make sure we watch the trends, because if we get too high or very high spread, according to the CDC, we may have to put them back on.
Sure. And, you know, today I also had a chance to talk with the Secretary of Education, Miguel Cardona, was on the show. And I had a chance to speak about this move to lift the mask mandate in schools across the U.S. I want to get your reaction to what he told me.
You know, again, we listen to the CDC guidance around masking. We know it works. We were at 47% of the schools fully open at the beginning of the Biden administration. We're at about 100% now because we followed those mitigation strategies. And it's really important that we take this opportunity to remind folks that the spread is less when students are vaccinated, when those who are eligible are vaccinated. And I think vaccination and testing availability must be taken into account. Community spread must be taken into account before making decisions about removing mitigation strategies that keep our kids in school, keeps our schools staffed.
Doctor, your message to parents.
Well, I think the Secretary is spot on the importance of vaccination, especially of kids 5 and up. I have a 6-year-old who's going to school, and she's fully vaccinated, and we need to get that number up significantly in New Jersey, well over around the 50% range we are now. It is reassuring that in New Jersey, well over 85% of everybody over the age of 5 is fully vaccinated. And I think these policies should also depend not only on community case trends, but also community vaccination rates, because if we overall have a more protected population, it ends up being safer to remove some of these restrictions, at least temporarily.
Dr. Shereef Elnahal, appreciate your time today. University Hospital there in New Jersey.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.